Brian Connor. I am the chiropractor at Healthy Ways Wellness Center, as well as the medical director and a nutritionist. I did this presentation a little over a year ago, but a lot has changed since then, so I hope you learned something new. I'm going to do an outline of my presentation here. So this includes my personal life, education, career, and credentials, integrative team at the Wellness Center, what's new at the office, a virtual tour, how I treat patients, the supplements, herbs, and CBD that we offer, other miscellaneous details, and then Q&A at the end if we have time. Okay, so some personal details. I'm married to my wife, Mary Alice. We live in Bridgewater. I have two siblings, Billy and Christy. My parents, Julie and Will Connor, and a daughter, Emily, who's 16 months old. Here's Emily from Christmas.
So cute.
And that's the Connor family right there. All right, I'm a Brookville High graduate of 2006. And then I went undergrad to SUNY Cortland in upstate New York. I was a pre-chiro and biology major. And then on to New York Chiropractic College. I graduated in 2012. And then in 2013, I became the medical director at Healthy Ways Wellness Center. So credentials, as I said, medical director. I'm a chiropractor licensed in Connecticut and New York. Certified dietitian nutritionist and certified nutrition specialist. Certified in ART, active release technique, full body, kinesiotaping, meridian autonomic testing, and I'll explain all these things later. Certified in DOT and CDL physicals. Recently certified in functional medicine. Certified in sports science and human performance, and now I'm an adjunct professor at the University of Bridgeport. So the definition, what is chiropractic? Well, chiropractic, doctor of chiropractic, chiropractor, chiropractic physician, they can be used interchangeably.
It's like any industry.
A few pictures here of all the stuff on my walls. That's my Connecticut Chiro license and my New York one, and my diploma from NYCC. And then that's showing that I passed all 4 parts of the chiropractic boards. There's my sports science certificate, a nutrition CNS diploma, and that's my nutritionist license for the state of Connecticut. That's showing that I can perform DOT, CDL physicals for truck drivers. And I recently got this. This is my certification in functional medicine. There's not many, I think there's less than 1,000 certified worldwide. Kinesiotaping, so that's basically, you see that a lot at the Olympics. It's the colored tape that the athletes use. I'm certified in that. ART, it's kind of a myofascial release, thin and stretch technique, full body certified, and these things require, every year you have to be recertified to make sure you know what you're doing. MAT, meridian autonomic testing, that is basically muscle testing. So if you've heard of muscle testing or AK, applied kinesiology, that is a form of that. Bachelor's, I ended up getting that at NYCC because I transferred from SUNY Cortland, so I ended up getting my bachelor's at NYCC. And recently I became an adjunct professor at UB. On Fridays I teach chiropractic technique to 6th semester students, and there's 35 kids in the class. And I teach ortho and neurologic testing to 3rd semester students. That's a smaller class, about 17 students. So at the office, 3 nutritionists and registered dietitians, 2 massage therapists, a licensed acupuncturist and exercise physiologist, that's Chris of course, right there, and certified personal trainer. We have a couple Reiki masters, certified yoga instructor, a cosmetologist, hypnotist and guided imagery master, and a now recently certified thermographer, which I talked about. As I said in my 45-second, we're offering thermography. There's a few spots left in our February class. And as Dr. Julie mentioned, we now have a residency program, competitive 6 to 12 month residency program for doctors, chiropractors, physicians to get their practice hours. So 6 months to a year, starts in July and January, and it's 3 options: 850 hours, 500 hours, or 250 hours. Okay, so let's do a virtual tour of the office. So this is my main chiropractic room. I got a pretty good table. It's got all the bells and whistles. As a chiropractor, you want to have good equipment. It's the main thing you use is the table. So, nutrition room. That's where I do nutrition counseling. Reception area. So that's where Billy and Chris spend most of their day. The other Chris, not this one. Store and waiting room, massage room, and personal training yoga. That's in the basement. We have a little gym down there. Spa room, our acupuncture room, where Chris is most of the day. Reiki room. We have a hypnosis and guided imagery room. Nutritional testing room, so that includes the wellness scan, the antioxidant scan, and the body fat analysis. Dr. Julie's office, where she does nutrition counseling. All right, so why patients come and see me? So pain management, of course, but not just back pain, neck pain, headaches. I treat a lot of other things. We do orthotics through foot levelers, people who have foot pain, spinal evaluations, the DOT, CDL physicals I talked about, nutrition counseling for medical problems and weight management, and functional medicine assessment. So how I treat patients, basically I can order x-rays, MRIs, blood work, diagnostic workups like your primary can do. I just don't prescribe drugs or do surgery because that's kind of goes against the whole holistic approach as a chiropractor. So we don't do that, and if a patient needs that, we refer them out. How I treat patients, so spinal manipulation, of course, that's the adjustment. Kinesiotaping, I talked about that. Electric stim, ultrasound, shockwave therapy, cold laser, pulsed electromagnetic field, PEMF, and orthotics. So we use a variety of supplements and herbs, mostly from Standard Process and MediHerb. There's my orthotics 3D scanner from Foot Leveler. So you step on that little, looks like a scale, and I scan your foot one at a time. That is the body fat machine. So we use near-infrared spectrophotometry. That's the same technology that NIH uses, National Institute of Health, for measuring body fat. Scale, kind of self-explanatory. Hot packs, cold packs. Cold laser, that's good for inflammation. Uses a red infrared light. PMF, pulsed electromagnetic field, also good for inflammation. A lot of orthopedic doctors use that for fractures, kind of speed up the healing time. So maybe the athlete can get back on the field a week faster. Electric stim and ultrasound. So stim kind of relaxes the muscles. Ultrasound is kind of a deeper penetrating heat. All right. Shockwave therapy, good for plantar fasciitis, golfer tennis elbow, Achilles tendonitis. Kinesiotaping, I talked about that. Vibrocrusher, that's just a vibrating massager. And arthrostim, that's kind of a gentle adjusting tool. So people who don't necessarily want to get maybe their neck adjusted manually, by hands, you can use that little tool there. It's pretty good. All right, different topicals that we use for pain relief. You can see CBD, BioFreeze, Jadiance, some essential oils, arnica gel. MAT, that's meridian autonomic testing. That's the muscle testing that we do. So basically, you would take the vial of that supplement, you put it in your hand, and I would test your strength to see if that one's good for you or not. Essential oils that we offer. Isogenics, that's a weight loss program. They have meal replacement shakes and bars. Optavia, also weight loss program. It's more soy-based. They have a bunch of snacks and bars and meals. Image Skincare, Standard Process and MediHerb. That's a very popular line that we use there. Very good, high-quality whole food supplements. Other ones that we offer: Juice Plus, Pure Encapsulations, Metagenics. Nordic Naturals Fish Oil. They're probably the top quality fish oil company in the world. And Simpson Vale Tea. They're out of Brookfield. We have a Federal Road presence. All right, so recently we started carrying CBD, that's cannabidiol, hemp oil. So we offer it in a few different lines, going from weak to strong. It would be brown, green, gold, and then the pro line. So we have it in drops, gummies, oil spray, capsules, soft gels. All right. Insurances I accept: Aetna, Blue Cross, Cigna, Connecticut, Oxford, United, and Medicare. So pretty much everything except Husky, Medicaid, state insurance. I don't accept that, but pretty much most of the main insurances I take. Hours, Monday through Friday, 8 to 6:30, Saturday 8 to 11, and emergency hours and home visits are available. Organizations I belong to, besides BNI, of course, the Brookfield Chamber of Commerce, the Connecticut and American Chiropractic Association, the Institute for Functional Medicine, and Board for Certification of Nutrition Specialists. And any questions, you can always email me or have a one-on-one if we can't get to it today. All right, Deepak.
Please help me clear up my misconception. My perception is chiropractors, they're dealing with spines and mostly joints and stuff. But when it comes to muscles, who should I go to actually? Is it going to be Chris? for, you know, acupuncture or for yourself, or, you know, whatever you do, right?
Well, usually they work really the best together when you do both. They're kind of almost like synergistic, where if you do both acupuncture and chiropractic, you'll get the best results. Because sometimes just doing chiropractic doesn't necessarily get, you know, 100% improvement. You might get 90%, and then, you know, the acupuncture will help get, you know, the rest of it, or vice versa. Yes.
Just two quick questions. Where are you located again?
We're in Brookfield, near the YMCA on Federal Road.
Okay, great. And go back to the weed. What is that CBC stuff?
CBD. Oh yeah. It's no THC, so it's 0.3% or less THC, so it will not get you high. But
What will it do?
What will it do? It's good more for medicinal effects, so anti-inflammatory, good for anxiety. There's a lot of studies for epilepsy, seizures for CBD. If you go on PubMed. Yeah.
Thank you.
No problem.
Great job, guys. I highly encourage you to go